All right, thank you, Dennis. We're going to check back with you shortly. New here at 6 tonight, some call it the silent tragedy, the number of women in America dying from pregnancy or childbirth complications.
ABC Action News reporter J.J. Burton finds out Black mothers and their babies are at the center of this growing problem.
The numbers tell the story. 17 out of 100,000 American mothers are dying yearly. And that's more than double that of women in other developed countries. See for yourself.
We need to do better.
But for Black mothers, advocates say better has to start right now. And Black mothers die at 3 to 4 times the rate of white mothers.
Our women are more risk.
And the CDC describes it as one of the widest racial disparities in women's health. For example, a Black woman is 22% more likely to die from heart disease than a white woman, 71% more likely to die from cervical cancer, and 243% more likely to die from pregnancy or childbirth-related causes. And the numbers aren't better for their babies.
If we look at Black babies, they die at a higher rate than white babies.
A local OBGYN, Sharon Ingram, and I spent about 2 hours on Zoom talking about this growing crisis. For her, it's personal for 2 reasons. She's Black. And this is a picture of Dr. Ingram holding her newborn baby boy, AJ, the day before he died.
I actually had a child pass away from SIDS at 4 months of age, and he would have been 21 years old today.
And she was in med school at the time.
Of course, at that time, it was devastating.
SIDS is sudden infant death syndrome. Dr. Ingram says SIDS is one factor on a very long and growing list of factors contributing to the increasing maternal mortality rate in America. Add to that racism within the healthcare system and implicit biases against Black and brown women, and you have the reason so many Black mothers and so many Black babies are dying. St. John Progressive Missionary Baptist Church is in the middle of a neighborhood with one of the highest Black infant and maternal mortality rates in the county. The church partnered with the Healthy Start Coalition of Hillsborough County to secure a grant specifically to help local Black mothers.
We developed a partnership with them that we could reach out to individuals in these zip codes that our churches are located to have access to prenatal health care. And that's been going on for 20 years.
And still, those numbers are growing. Dr. Ingram says the best way for doctors to help Black women, be aware of your implicit or unconscious biases. Treat all of your patients with the same respect. Ask them all questions. Learn about different races and cultures. And listen to the patients.
The biggest thing is looking at every patient for what their risk is, what they're bringing to the table, looking at their medical conditions.
On top of that, Dr. Carolina Hernandez says we need to start tackling racism within the healthcare system.
There's a lot of emphasis politically placed on abortion and whether or not women should have the abortion, but there's not a lot of emphasis placed on helping minority women even get pregnant and conceive or be able to carry a child to full term without the woman being in danger or the child being in danger.
From the government, I think that they need to put emphasis in reaching out, and so that minority women have access at least.
Currently, there's a bill in Congress called the Health for Moms Act.
Patients on Medicaid will have insurance for the whole year after they deliver. Currently, if a patient applies for like emergency Medicaid, they're only covered for 60 days after they deliver. But that mortality rate goes up to the whole year.
Florida House Speaker, Republican Chris Browse, is pushing for a similar bill here in the state, and it has bipartisan support. Florida Democrats are pushing for the state to make implicit bias training mandatory at all hospitals.
This is a very huge issue, and there's much more information. We couldn't get into the story here, but we have a lot online. abcactionnews.com. Just click on this story. We have the interviews with the doctors, as well as some tips to keep you safe. Reporting in Tampa, J.J. Burton, ABC Action News.